Okay. There's unfortunately a syndrome in consumer circles, known by a variety of names, but what you could call survey fatigue, where, we've got another survey to fill out. I wonder what sort of answers they want. I think they want these answers, so I'll answer the questions according to what I think they want out of me. So the validity of the survey is out the window. If you've done one evaluation form as a consumer in a service, you've done umpteen. And if you've been involved with 3 or 4 different services, a clinical service, a rehab service, a day program, a training program, you become accustomed to it, and they can put in all the control questions with the reverse answers that they like. We're savvy to it, and we think, well, no, I don't like this person. I'm going to make sure they get a bad rating out of me. This one's been fun. I've enjoyed this training. Let's make sure they think I've done well. And so you actually understand the structure and the nature of surveys that well that you could almost design them yourself. So the bean counters, I don't think they realise just how much bean counting goes on. The number of surveys you fill out, and I won't name them by name because they're all patented and they're all licensed, and we all know which ones they are. The consumers know about them. It's nothing new to them. So you're not really getting a true reflection. Qualitative research is more valuable, but then of course it's coloured by the opinion of the person doing the research. So it's a lose-lose situation.
Would you what would you prefer to happen for research to support programs? Where do you think that information should be coming from?
We used to get by in the past without these surveys. The services were still delivered, the outcomes were still good. I think you've got to look to realistic outcomes. How many people are exiting a crisis service and succeeding and staying exited? How many people are maintaining employment and continuing to maintain employment? Trying to measure their quality of life when they think, oh, they're measuring my quality of life. I'll answer this way, that way. No, there are some real solid stats you can gather without even actually, with the consumer's permission, but without them actually filling out a survey which reflect how well a service is going. You don't need to do a measure of how unwell they are, which is one of the surveys does in the clinical sector, or the quality of life surveys that measure the general population and just happen to be used for mental health at this time, short versions of those. I think you know which one I'm talking about. It really is of very little value, in my opinion. I know other people disagree, but you shouldn't underestimate just how clever consumers are when they've been doing surveys. You know, you feel unwell when you're maybe 18. By the time you're 58, well, you've got 1 year left before you're supposed to die, according to the mortality rate. But anyway, by the time you're 58, that's 40 years of surveys. You kind of know how to do them, and you reflect how you're feeling. I don't like this person. I'm going to make sure their survey rates their service poorly. The service may be wonderful, you know, but we know how to fill out the survey.